Obamacare is part of a socialist takeover of the United States of America. It puts health care on the wrong track, and it will expand the role of the federal government in every aspect of Americans' health care. The Affordable Health Care Act provides protection from the worst insurance company abuses, and it makes health care more affordable and accessible for everyone. I'm fairly certain that everyone in this room is aware that Obamacare and the Affordable Health Care Act refer to the same law. Whatever your opinion is politically, the facts are that the Affordable Health Care Act became law in March of 2010, and it was upheld by the Supreme Court in June of 2012. By the sheer fact that you are a human being, it is likely that you or someone in your family will require health care in 2013. So I thought I would like to step back from the political controversy of this law and talk about how the law will affect you simply as a person in 2013. The first item of interest I'd like to share with you is that with healthcare plans effective beginning in September of 2010, lifetime limits are prohibited. So what does this mean? Well, if you work here at Verizon and your healthcare plan was effective January 1st, then you haven't had a limit, a lifetime limit, for the past 2 years. If you can find an open enrollment guide from plan year 2010, you will probably see that you had a lifetime limit of about $2 million. Now, if you didn't have a lifetime limit, then you should be very thankful that you work for an exceptional employer. Because prior to the passing of Obamacare, only 40% of employers offered health insurance with no lifetime limit. Now you might say, $2 million is a lot of money. No one can hit that cap if they tried. But in 2009, 20,000 people hit their lifetime cap. What that meant is even though they worked for an employer who offered health insurance, and they had paid their premiums for that plan, they had no benefits for their illness. With the passing of the Affordable Health Care Act, that can never happen again. Now, since the focus of my presentation is on how the law will affect you, you may be sitting there thinking, well, 20,000 people out of millions and millions of people who are on employer health insurance, the only way that this law is going to affect me is to raise my premiums. Well, most reputable studies show that raising the lifetime, or taking away the lifetime limit, has virtually no effect on premiums. Now we shift from catastrophic coverage to basic wellness coverage. Also for plans beginning in September 2010, many preventative services must be covered at no cost to you. That means no co-payments, no co-insurance, and no deductible for basic preventative care. Now, a lot of media attention has been paid to this aspect of the law, but unfortunately we hear most about it as it pertains to birth control. This part of the law covers so much more. Your annual physical is covered at 100%. Cancer screenings such as mammograms and colonoscopies are covered at 100%. You can also expect to receive your annual flu shot and pneumonia shots at no cost to you. I want to give you a real-world example of this part of the law. I took my 2 children to the pediatrician in October for a flu shot, and I paid a copay that day of $30 per child. When I was researching to make this presentation, I learned that I should not have paid a copay that day. So I am now working with my HR department to get a refund on my copays. It pays to be an educated healthcare consumer. A lot of healthcare providers are not familiar with the provisions of this act. Finally, the Affordable Health Care Act has many provisions for promoting efficiency and transparency for the healthcare consumer. There are two items that you will see in the very near future if you have not seen them already. The first one is that employers must now provide consumers with a document that summarizes in easy to understand language a health plan's coverage benefits. They must also provide an example of two real world examples, such as managing type 2 diabetes and having a baby. Now, I have an example of a Verizon healthcare plan. Excuse me, if you could pass that around. I tried to highlight where you can see that Verizon is doing a great job of following the law. Specifically on page 7, they outline having a baby and managing type 2 diabetes. The second item is when you get your W-2 at the end of January, you will see that there is a box that shows how much your healthcare coverage cost in 2012. It is a combination of how much you contributed and how much your employer contributed. It's not taxable, it's for information purposes only. In conclusion, although the Affordable Health Care Act is politically controversial, it is the law of the land, as they say. I hope that no matter where you fall on the spectrum of opinion, I have helped to show you how some of the measures will affect ordinary people like you and me. People who may have employer health insurance but are facing an expensive healthcare challenge. Or people who are basically healthy, but it can't hurt to go for that annual physical. And also for people who want to be educated healthcare consumers and need to be educated healthcare consumers. So as we move forward through 2013, I wish you a happy and healthy new year.